body not gently. Mr. Coco Pandarani so sickness na motamani enemy, na motamani enemy. So if you get sick, do ya know either more? Make you doctor, cause now well body better pass the body. This life now one.
Kushemi Fambulen. This is Dr. Mafude Aswari with Well Body na Gently, a production of Well Body Salon. We'll continue upon this video for talk about hepatitis, and specifically for talk about way then for prevent hepatitis, especially hepatitis way caused by virus. So in previous video then, we don't talk about the different types of viral hepatitis, from hepatitis A to hepatitis E. We don't talk small, but some of the way then we can prevent get sick from hepatitis, viral hepatitis. So now that conversation they continue. If you miss any of the previous video, then looking at the description of this video and you will see the link there, and click on the link for watch the previous video then, or the link on your screen, and follow on for me you catch up on the previous video then on viral hepatitis. So this is what I can talk about now, but other ways then, besides we environments where we can do, besides we habits I should say, where we were able for use for prevent hepatitis. So some of them virus here, so what they call hepatitis, we get vaccine then, we're very, very effective for prevent the sick before you get the sick, right? So the whole point of vaccine now for put medicine at your body where go block that virus. So if your body ever exposed to the virus, your body not go get infected. The virus not go get sit on place inside your body. So hepatitis A, where now through contaminated food and water they get vaccine there for that day. So what we can do in terms of hygiene and sanitation for prevent hepatitis A, but also sometimes they're in a situation where you just don't know. So very effective vaccine there for prevent hepatitis A. Now 2 shots then 6 months apart. Now then Western world then they give picking then hepatitis A vaccine from where then small, from 1 year old they give 6 months old even they give the vaccine, and then they don't protect them for the rest of their life. So if you never get hepatitis A vaccine, and where they travel boku, especially they go back and forth to Africa and other, third world country, then now something that the way you can talk to your doctor or any provider but forget the vaccine. Boku of we born at third world country, then we don't get hepatitis A at some point. So we actually protected now, we'll get her again. So if you born a third world country, you can ask for medicine test for see if you're protected. If you're not protected, then get the vaccine, and then you don't need to worry about that. So that's hepatitis A. Hepatitis B, now another one where we get very good vaccine for, now a series of 3 vaccine there. Again, now one way we can get, even starting from childhood, we give them vaccine, and then we will protect the person for the rest of their life. Now, Western country, then people the way they work in healthcare, they required for get that vaccine, that maculate, because the risk for exposure is so high that it's very important for me you get protected from that. So very good vaccine for protect against hepatitis B. Now, some people that will get hepatitis B, their body naturally declare the infection. So they can actually do tests. They can tell if you don't get hepatitis B before, and your body clear the infection by itself, and your body protected. But some people then they get the infection, their body kind of clear the infection, but their body not able for creates protection, what we call immunity. So then kind of they at risk for men and get problem down the road. Somebody like that, they need for get vaccine still. And then you get people that will not ever get, they not ever get hepatitis B and they're not protected. They need to get the vaccine. Because one of the things that we'll talk about in the previous video, hepatitis B, now one of the infection in that day, where we say it can cause chronic problem na your liver and lead to liver cancer. So now the reason that they we make it important for protect against that. Even though there's a chance if you get on, your body can treat on for itself. But if your body not able for treatment, you can actually be set up for get liver cancer later down the road. And there's no way you go know until things then too late. So, vaccine. For down the way, then test and know say they get hepatitis B. They're not been getting the vaccine, now they get hepatitis B. Treatment then they were very, very effective for try for prevent and delay chronic liver problems from hepatitis B. So then another option. Know your status and get treatment. The sooner you get treatment before you get serious liver problem, the better for you. Hepatitis C, we not get vaccine for that, but we'll get very, very good treatment for hepatitis C. So if you get hepatitis C, you go seek treatment. In a few months, they can cure the hepatitis C. And as long as you not continue the habit or the thing that way put you at risk, will make you get on, you will be fine. Hepatitis D, and once you get if they treat you maculate from hepatitis B, go protect you from hepatitis D, and same thing hepatitis E also, way similar to hepatitis A, we're not very common, way also thing where most people they need for worry about. If you get question then una can send to question then on our Facebook page, on Twitter, on Instagram, or even email we na wellbodysalon@gmail.com. Again, this is Dr. Mafude Aswari. Thank you for waiting to watch the video. Stay tuned for our next video.